Rosie, how then does gender play out within the community health workforce? And are there any unique challenges that community health workers face because of their gender?
Yeah, so I think, as I said, community health workers, they're really in an interesting position because they have this unique interface in between the health system and the community. And ideally, they come from the communities that they serve. So they're not operating out of an institutional space that they leave and go home at the end of the day. They're operating within their communities and sometimes within their households or their neighbors' households. So those same, gendered norms and dynamics that mean that maybe women might not have autonomy over their health care seeking decisions also influence the ability of community health workers to do their role. And of course, gender norms are very context specific, so it varies and plays out in many different ways across different contexts, and also varies, for men and for women, of course. A lot of the examples that I draw upon will be women because women make up a large proportion of the community health workforce. So just some examples I can give you. Obviously, in terms of whether they have, so women might find that they don't have a family support to become community health workers. So I know that has evidence from Kenya has shown that men often, or husbands rather, might not be supportive of their wives taking up the role, especially when it doesn't have much financial incentive attached. And that's also been shown in Mozambique. And in Iran, more explicitly, women did need husbands' permission to become community health workers. And then, of course, when they're in the role, thinking through how gender plays out in the community. So it might impact on mobility. So is it acceptable for women in particular to travel freely through the community? So I know that in Pakistan, there are some negative social norms that mean that women traveling through the community is quite stigmatizing, and that obviously impacts on their ability to do their role. And it also impacts on career progression. So if women can't move freely around the community, which is needed to become a supervisor, then they might be locked out of that position. And then there are other examples. So I know in Nigeria, there was some evidence that women weren't allowed to ride motorbikes because it exposed part of their ankle, and that wasn't appropriate for women. So the men were able to travel much more freely than the women. And I know in that project, they did some sensitization with community leaders and worked around the problem. But there are other examples like that where quad bikes are perhaps more appropriate because of the terrain and because, women might be physically more petite and less able to navigate difficult terrain with supplies. So those are some of the sort of like more practical mobility things. And then I think one of the other things that's probably most commonly thought about is acceptability. So obviously women are very much accepted, especially when we're dealing with issues of maternal and newborn health. And that might be a challenge for male community health workers because they might not be as willingly accepted into the home. And often they may be treated with a little bit more suspicion. So I know evidence from Kenya, from the Reach Out project that I was involved in. Younger unmarried men were treated very suspiciously if they wanted to come into the home, like you have ulterior motives or you're here to steal something. So, these men were feeling like, well, we can't do our jobs. And they ended up, I think, perhaps in some instances having to falsify data. So it does have a knock-on effect on service delivery and the quality. Just thinking through all these different touch points that gender impacts on. And so the final example that I'll give you would be thinking through training. So if you have a training that's residential and it's away from home. So for example, I've done some research in Mozambique where the training program is 4 months and it's away from home. And this is quite challenging for women who perhaps had child caring responsibilities, and especially pertinent for single women, single mothers. But then conversely, it was also challenging for men because they were occupying this breadwinning role, and they were meant to be at home providing for their family, and they were, off training. And yes, they did get some stipend for the training program, but it's not a lot. And if you're away from home, you're not able to do the other income generating activities that you might normally partake in. So yeah, I think I'll leave it there, but those are just some of the ways that gender affects across the different touch points.